Hi, I'm Caleb Fairchild with the Mary Garner Memorial Fund for NeuroScience Research at the University of Notre Dame. Today I'm here with neurologist Dr. Randall Bjork of the South Bend Neurology and Trinity Health System. Today, Dr. Bjork is going to help us with some of the early warning signs of degenerative diseases, specifically multiple sclerosis. Dr. Bjork, can you kind of give us some insight of some early warning signs or things that people should be conscious of?
Well, with MS, it's usually a disease of young people, but it can strike in middle age for the first time, but it's usually a disease of young people. We used to call it the crippler of young adults, but we have so many treatments now that are disease modifying that it's important to get a diagnosis early, get the treatment started early, so that there isn't a cumulative burden of disability over time. We want to keep people out of wheelchairs.
Are there certain things that a person might experience, might feel, might see or not see that they should be aware of?
MS usually causes a deficit in our functioning, whether it's a sensory deficit, tingling on one side of the body, tingling of the face, even pain in the face, especially bilaterally pain in the face, is kind of a red flag for MS.
And if a person believes that this is starting to happen or is something that they think might be relevant to them, what are those first or next steps that they should take in either seeking treatment or diagnosis or the next steps?
The first thing I would do would be to contact the doctor and nurse who know the patient the best, and then the examination can disclose any deficits that might be seen on examination, and then we would be entering the picture. So we receive a consultation request, see the patient with history, and then a neurologic examination, which is a detailed examination. The MS examination tends to be a very quick and straightforward examination, and it's a lively examination. The reflexes are usually very brisk. The optic disc may be very pale, and so there's a physical change we can see. The pupil may react differently. When the patient looks at the floor, there may be a zing down the back, called the meat phenomenon. So if somebody gets that, that's a reason to call the doctor.
But the examination, like you said, can be quick. Doesn't have to be something that's scary or something that we need to avoid.
Yeah, if it's florid MS, it doesn't take long to make that diagnosis.
Well, thank you, Dr. Bjork, for giving me some time today. And as Dr. Bjork said, if you think that you are experiencing these things, or if you are curious about the next steps, definitely make sure to contact your primary care physician or a medical professional. Thanks for watching.